Young people start very early compared to us who start later. But as long as you're sexually active, go and check for cervical cancer. What does it entail? Just a small procedure. Doesn't take a lot to check. It's not expensive. You check and you have your annual checkup. You'd rather spend to check yourself annually than have to pay for the cost of treatment of cancer. You always hear about cancer treatment in the newspapers. We are raising money. But if you check and you pay 50,000, even 100,000, that will tell you the millions you have to pay in treating the cancer. So this is not only for women, but it is also for men, for your wife, but even for the other types of cancer. This thing is real. It's not only for 30s, 40s, even in our 20s, 15s. So look out and start. I told Carol and we are trying to emphasize it to HR. Maybe we should reach a point and say every year within our within our annual cover, every year, every staff should go and have a check. It's not expensive. Have a check. You lose nothing. For men, you can go and do a prostate cancer check. You can do a breast cancer check. You can do annually. You don't need to test yourself annually. We were in a country where I went with my mom for Christmas, in Cuba. So then when a girl turns 13, it's like a transition. They tell you now you're 13, you're allowed to have sex. You're free. But from that time, the government follows you up to your annual checkup. And they follow you up. Have you gone to check? Have you gone to do this? Carol, Linda. You probably need to start saying, guys, go for checkup and can't speak to me. Would rather pay for the checkup than having to have later on, and then you start running for money. It fails. We've lost people. We lost Benjamin recently. Out of cancer, we can work together and save our lives, save our wife's life, save your husband, save your parents, encourage your parents to go for prostate cancer for men, cervical cancer for ladies. Every lady here, you should go for cervical cancer check. You say it is expensive. The fertility, look, is this clinic in Cambodia? Women's clinic in Cambodia. In Cambodia, down here, towards my, it used to be Family Planning Association of Uganda. My mom used to work there when I was little. Go and check. A cervical cancer check is not more than 20,000. Very cheap. What do we lose? Make time. Tell your boss I'm coming late. And you go and check in the morning. It takes about 10 minutes to save your life. But it starts with you. It starts with you. Even your lifestyle. You sit in the bank. You sit in the bank, you sit the whole day. You don't get time to move. You try to start people dancing. People are dancing. Go and dance. Go and be part of it. You don't need to know how to dance. You just go and move. If you're on your desk, when you go for lunch, you have your time for lunch. Can you go up the stairs? You have steps here. Up to the next floor. But you see, Baguma pressing the lift. To go to third floor, to first floor. Yeah, please. It's very important for you. My association with Uganda Women Cancer Support Organization is, I think my mom and David were one of the first people to start it when my mom came back and she had survived prostate cancer. And it's so amazing. I told her, see what your organization and the people you started is doing. It's changing lives. Thank you, Jeffrey. Continue to touch lives and spread the message. You're welcome. As DTB, we'll support you the best way that we can, to work with you, to help. At HR, you have a task. And have a people, a staff, go for check. It's not a I told you, go and work with a clinic, and we get a special rate. Most clinics in the month of October reduce their rate for a mammogram, reduce their rate for cervical cancer. for prostate cancer. Can we do that? I had touched you, whatever. It is still outstanding. Performing. Yes. Please get it so that we go and check. We go at a reduced cost in partnership with Agacan or something and have our checks done. It's very important so that we save the cost of spending on breast cancer treatment. Thank you very much.
Thank you very much. Please sanitize the microphone and push me to C and D. But friends, just to feel back on a serious note. Cancer has a heart. Yes, it's there. It can be deadly if you don't take action very fast. So the earlier you go, the better. And as you've been seeing on the different channels of WhatsApp, we've been saying, go for testing. The camp at Kampala Hospital is still on. Please go. Ruby Medical Center is still on until the end of October. And they're already receiving us and staff to be able to be supported. So feel free. If then as you're online, don't hesitate. Please go and also be tested up to the 31st of October. That is Monday. So as Monday closes, go and be tested. This testing is free within this month of charge. All the TB staff, DTB customer, and of course members of the public that love us, go and do the testing. It's all available at no cost. Thank you very much. The question time is here. Can I see the first 5 questions? No show of hands. First 5 questions. 1, thank you. She has a gift hamper. I paid for you a dancing kit. That is yours from me to you. And the second person to ask the question. Okay, you can ask. Maybe let's give you first ask, then others will get the energy and come after you.
Thank you so much, Peter. Thank you so much, Peter and Vicky. That is about the vaccine, and we just want to gather information about it. From what age is the baby born? Thank you.
Okay, she can answer now. Thank you very much for your question.
Thank you so much for your question. The vaccine that's provided by government of Uganda is 10 years in and out of school. But anyone who is not sexually active, who has never started sex, can have the vaccine at any age. They put 10 years because of the cost. And of course in public health they see the most beneficial, where the most benefit is. Then they said, at first they said 9 to 12, then when they rolled it out further, they said 10 years. But they said 10 years, but if you have a kid who is 11 or 12 and take that child to the health facility, they will not chase you away, they will give the vaccine. And even you can have a vaccine as long as you have screened and you have no HPV virus after your screening. So you can, but at a cost. The dose used to be 60,000, maybe about 120, because there are 2 doses. But I think it depends on which provider. I hope I've answered your question.
Thank you very much. I'll be the first person to ask the question. You will get a certificate to dance in. Okay, any other people with questions? Yes, Mr. Kabuzi, come over here. If you're online and you have a question, please share your question online. We shall also be able to see it. And at the same time, we have seen your question. Thank you very much. The others, you're there, share your questions online as well. Thank you. question. One, does the vaccine cut across all lines, females and males, or only for the female children that are young, that are just preparing to get that stage of brain? And number two is it true, as I hear that cancer, all human beings have cancer cells? Is something I've been hearing people talk here and there. I want to hear from you, because you have experience. Do you all have cancer cells in our bodies? It is just a state that matters when the organ accumulates and the danger becomes high. Thank you.
Thank you so much for the two questions. I can start with the last. All cells can be cancerous at one time, because the way cancer develops is the normal cells becoming abnormal. And becoming abnormal, then they become cancerous. At one time or two, you may have cells somewhere becoming abnormal for one reason or the other. But maybe because of your immunity, because of your lifestyle, they may disappear and they live on. So when they continuously become abnormal, then they become cancerous. So all of us are at a risk of our cells, normal cells, because our bodies are made of cells. Wherever, with the skin are cells, the blood, the blood are cells. But at one time, for one reason or the other, it may be infection. There are cancers that are caused by infections, as we talked about the HPV, but also we have another infection of the liver, which brings the liver of the cancer of the liver. That is, I forgot about hepatitis B, and I think also hepatitis B has a vaccine. But if you continuously get the infection of hepatitis B, your cells will become abnormal. And because of your low immunity, if you are an alcoholic, if you take a cigarette and you have other exposures, then it will be easier, and maybe the diet is not good, then it will be easier for those cells to continuously become cancerous and you get cancer. But if your body has its mechanism, defense mechanism, they may clear and you live on, and they may never see a cancer. I don't know whether I've answered your question. Your question number 2 was whether the vaccine is for boys and guys. Yes, it protects both boys and guys. But because our government, we don't have that much money to give both. So who has the highest risk? It is the girl. Because when you see the number of patients who get cancer from HPV are more are women. They get cancer of the cervix. But the men also get penile cancer. But at times, men carry the virus but don't get cancer, especially those who are circumcised. So the rate of cervical cancer getting men is lower than in women. So that's why the government takes the choice to vaccinate girls. But in the US, all young are vaccinated, boys and girls. Because also we know that in those countries, we have those other types of people, they call them transgender, and they use other routes. So we have a lot of anal cancer also coming here because of those other routes that our young people are adapting. So the HPV enters that part of the body, and they will get a lot of anal cancer. There is increase in oral cancers, because that virus, as it gets into the cervix, also it gets into the mouth. So as also you try oral sex, then you know who is that person, because that virus will get into, and then you have a lot of oral cancers now coming up, anal sex is coming up, I mean anal cancers is coming up, and penile cancer because of the HPV. So if we vaccinated the girls, then all these ones are reduced.
Just to make it simpler, penile sex is sex of the penis. Is that right?
Penile cancer.
Penile cancer
is cancer of the penis.
Of the penis.
Yes.
So meaning Gentleman, the man in here, yours are please. So let's take care of it that way. And I think there is a very big message that our president one time mentioned, that there are parts that together is for certain purposes. Please use those parts for their purposes. Or else you are subject to transmitting cancer. Okay? Because we don't have oral sex, oral cancer, mouth cancer, if we don't use other parts to do what is not that good. True or false? Yeah, so please, let's do that. Caroline is asking online, and she's asking this question. She says, after how long should one go for cervical cancer screening? I think she needs emphasis on the periods. How soon should we do this cancer screening?
It is recommended that every 3 years a woman should have cervical screening. That is when you don't have any other health challenges. But if you are a person living with HIV, you are hypertensive, you have other complications, you know your body immunity is low, you should be going every year. But if you have the opportunity and the facilities, you can go every year to your health provider and then have a pap smear, have a visual inspection of your, you just look at your cervix and then so that you're sure that you don't have.
Thank you very much. Any other question? We come over, Esther. Esther, come forward. Yes, as Esther is coming, circumcision for the men that are circumcised, I think the risk becomes lower. It's lower for cancer. For you to help the cancer grow, but you have the cells in you. So that's why again government says please go for circumcision. It helps you to reduce the risk of you catching the cancer. So that's the solution for you, the men that are here. This is here.
Now that I'm not a doctor, I may not say yes or no, but the risk of such being in you for 5 years without causing cancer, maybe it may cause cancer in you within 1 year. So having other health problems is a risk because your immunity goes down and you will be susceptible to cancer.
Thank you very much. So if your immunity is down, you're susceptible to cancer. Make sure that we get the best of immunity up. Boost your immunity as much as you can.
Thank you so much for the opportunity. My question is one, the type of food we eat. We have a colleague who was, she developed food muscle high and she went to the cancer institute. She had a minor surgery, but the doctor suggested that she goes for cancer screening, which they did 5 months back. Unfortunately, she tested negative. But during that period of 5 months, they stopped her from some foods, including meat. So which food should we eat and which food shouldn't we eat? Then related to that, the cancer survivors, are they stopped from eating some food? That's my concern. Thank you so much.
Yeah, thank you so much. I think the issue of food is a big issue. And it depends on who tells you not to eat what or what to eat. Many times I have seen patients because they come for counseling and they say somebody that told you to stop eating meat. And when I ask who stopped you, they say I was seated in the line, and then others said if you eat meat, the chemotherapy will not work. And others said that you said if you talk to your doctor who is giving you the treatment, he said no. These other people, either the visitors or the family or Mr. Google. So I would advise that if you want to stop anything, you have your care provider, your oncologist. You should be able to discuss this. And we encourage patients that when you go for review, ask your doctor, what should I eat? Now we have seen patients, chemotherapy is a very aggressive treatment. And it kills cancer, but also it kills the normal cells. So definitely your immunity goes down. So when you stop protein, your body stops functioning. when you stop carbohydrates, that's why some people are bedridden, because they've had, don't eat meat, don't take meat. And the meat we take in this country, on an average home, you buy 1 kilo and you are 10 people. So I think that meat is not too much to make you too sick. So you buy 1 kilo, some people even buy half in this economic condition. And you have your 10 members of the family. So if there's not even that little, then when you go for chemo the next time, then they say, you don't have blood, then you come back after 2 weeks. Then meanwhile people are telling you don't stop eating the meat. So and as survivors, we encourage a balanced diet. We got our people science. There is protein, there is carbohydrates. You need your body to be healing. Because after this aggressive treatment, the hair has fallen, the color has gone, you need to get back into the body has to function again. So what you do is you have to eat protein as God gave them to us, and all of us go through primary. We know what it means by balanced diet. You need some food that gives you energy, that is carbohydrate. You need some minerals to make sure the food is properly digested. You need the vegetables and the fruits. So your plate should be half fruits and vegetables, and then have the carbohydrates, have the protein, and have some bit of oil to make sure the food is. So I hope I answer your question.
Thank you very much. Do you have any other set of questions online? Please share your questions. We are ready to read them and have them over. But as we wait for the questions, very important information I've had is, yes, see a doctor, make sure you do the right diagnostics, and don't listen to just people, see the experts. They'll help you to manage the situation. And very important, not everyone with cancer died. Okay? You don't die because you have cancer. People have survived with cancer. They have gotten the best medication, they have managed to this, and they have beaten cancer. So therefore, no matter who it is in your community, your family, your friends, talk to them, let them see the right people, start early, do early detection, start early treatment. That helps you to get rid of the challenge of cancer. Some more questions, please? The first people that I registered here, the first 4 people, you all have biscuits. You have 1 kit for yourself. Thank you for those that have asked the question. Any other question? Ms. Rose, come over here.
Thank you. It is true that chemotherapy increase in some cancer patients increase suffering. So
I think this it may feel you if you don't do what I've mentioned. Because I have seen people dying during the treatment, not because of the disease, but because of what they are going through. People are told, don't eat meat, don't eat rice. There's something of late that says you keto diet or something. Somebody only takes food that is not cooked and it's from fruits and something like that. So the body is completely drained. And when you go for treatment, the body can't sustain the treatment. It can kill you. That's why I emphasize that if you have a patient, discuss with your provider. Because what I need in my body is not what you need. Some people have other complications. You are diabetic, and the food I need as a normal person is not the food that the other person needs. And the age also matters. If I'm a young person and somebody is an elderly person, cancer patients don't eat this, you don't eat that. So if you listen to the general knowledge that when you're a cancer patient, stop this, stop that, you may die through treatment because the body can't sustain the treatment. So it's always very important to discuss with your doctor. They may not have the time, but we encourage patients to write down what they want to ask. So that when you go in and you say, how are you? You say, this is how I'm feeling, this is what I eat this or this student. Because for them, they are not training you to talk. But when you trigger them, they will talk with the questions that are relevant.
Thank you, Doctor. When one of the reports, you told us about the signs of breast cancer. For the sake of those who are not yet here, we hope you will repeat. Then too, are they the same signs for cervical cancer as well?
One thing I want to emphasize that we shouldn't wait for signs. So the signs is when you don't have access to screening, and which are promised, and I see they are offered from the ED that you can have the screening before you see the signs. But nevertheless, you can still look out for those signs. If you went to the scan and these were missed, a lump, something unusual in your breast, and you need to palpate your breast. You cannot look at it and see the lump, but you need to routinely palpate so that you press all of it, you touch the nipple intentionally to see exactly what is there that may be normal. Is anything coming out from the nipple, blood, discharge, pus, water? So always there is something, especially when you're still an active person. You may not be pregnant, but maybe just win the baby. So there may be some milk, but don't squeeze so much until you see something. When if there is a problem, even if you don't squeeze the blood, you will see something in your blood. So we just encourage you to be more cautious about your breasts. You may find your breasts are always, when you come in the mirror, the nipples come out nicely. They come out. But one day you see the nipple, one of them, all 12 of them are retracted. They are facing inside. Then you should start to worry. You may see dimpling on your skin, which has not been there. But that's why we say you need to check it regularly. Maybe it may be something different. So if it is persistent, then you know this thing is not normal. But you don't wait. Because some breast cancers don't show any signs. There's what they call inflammatory. If you just develop something inside where you can't see, so you won't see. That's why you see when in the US, the people who are diagnosed at stage 4, and they always waited to see signs, but they didn't see. So not all of it will show the signs. And they are not the same signs for cancer of the cervix. Because you can't see the cervix is above your private parts, somewhere between the private parts and the uterus. So you cannot see the cervix. So when you wait to see the signs, it will be late. And one of the signs is blood. When you are not in your menstrual period, you're regularly bleeding, everything, 2 weeks, that blood. But also blood after your intercourse with sexual intercourse with your loved one. You start seeing blood and it's painful. And also maybe you have backache or lower abdomen pain. But by the time you start seeing blood and pain, that means the cervix is actually eaten. So the cervix, when it has the virus, it has nothing. It's only through the screening that they'll be able to say this cervix has HPV, then you can treat it. Otherwise, if it develops into cervical cancer, it is too late.
Thank you very much.
I've seen some ladies they started touching their breasts. They started checking, so it's good, but you go home and take off the clothes and check properly. You check, they tell, I think they advise the 3 fingers to check. So go and, even Mubangizi, go and look at your wife's breast and say, I want to check. Before you enjoy other things, just make sure that, you check. I was just going to just add on to what you said about chemotherapy. What I know about chemotherapy is it's a drug to kill cells. And in the process of killing, because as she has explained to us, cancer cells are those cells that cause the body change, change in the system. So that chemotherapy drug is a drug that kills all types of cells. That's why it will kill the cells that make the hair grow. It will kill the cells that bring color to the nails. That's why some nails will turn black. And so it kills everything. It's supposed to kill good cells, bad cells, but in the process it also kills some good cells. But it was made to try and cure cancer. That's why for survivors.
I think that tells us it's a responsibility of all of us to make sure that we are fine. Okay. So someone has a question here as I come to give another question.
Madam, I would wish to have some knowledge more about leukemia. How is it passed on to other patients? I don't know how it is transmitted, the leukemia due to cancer with the blood. But I think then number two, is there an effort done by the organization to integrate the herbal medicine? Because I've heard them talk about them from ABCD. Have you done any effort to see their effectiveness in the cancer fight? Or like, for example, I've heard about Dr. Semfuka of Kisubi, the fight. They've been talking on TV. What is your say about him and others?
Thank you very much. I think as we mentioned that every part of the body can get cancer. Every part, apart I think from nails and maybe hair, because those are residues of cells. So leukemia is cancer of the blood. And the blood also becomes abnormal. The cells, one of our members is a leukemia survivor. And she has survived for now 12 years. And she had this acute leukemia. And she was my workmate. We worked in the same office and we shared almost the best. So when she got cancer, I had walked the journey for about 9 years. So I had this experience. So it's also treatable, like any other cancer. And we thought at one time she was going to make it, because there was a time when she had 0 and she went into coma. And they needed to transfuse her, so she needed about 5 pints every time. So I worked with Bolole, and the company went to Nakasero Blood Bank and donated blood. And they had this rare blood, A-. So we couldn't even make the blood as she needed. But because we donated a lot of blood, so every unit that Nakasero Blood Bank got gave it to her. And she survived. But I think why she survived, the psychosocial support around her. The husband was very supportive. And that is also very key. The support of the spouses is also very, very key. Because if you see the people neglecting this family, and also the employer. I also survived because my employer, the staff, the colleagues, people did everything. One of the people at my work, the secretary to the MD, used to offer to make drinks for me every day. And she would make a cocktail without water and give it to me. So during the time of chemotherapy. So all those things, and because so many people supported me, I also came to support that lady, and she's also one of us. So I think the support and also the adherence to treatment. I have seen some leukemia patients. There was a patient who was doing well, and the herbalist told her that we will cut somewhere on the vein and they put some drug in. And when the person has leukemia, they don't have the properties to the blood to clot. So they always bleed under the skin. So this person bled to death. But of course didn't die there, but kept bleeding under the skin and the patches. I don't have any evidence that herbs work. Even when I was a patient, I took some herbs, but after, because people said take this, but after some time I had already done my treatment play and I survived. But I have bitter stories from some of my neighbors and survivors about herbals. So some people stopped treatment and they went for alternative medicine, and along the way it didn't work and they come with the advanced disease. So I cannot say I have evidence, because I don't have anyone who have said to me that they have been treated. Even those who on herbs, they mixed the two. They go here and they go there. So that needs more research.
Thank you very much. Watch Mr. Baguma come over. Ask a question. But in the meantime, we have shared the video that Sanyu shared at one time. The video of how to screen cancer, breast cancer specifically. Gentlemen, don't get excited. How to do self-examination for breast cancer as a lady and of course supported by your partner. Gentlemen, as you said, view that video, don't get excited by the smoothness there that you see, but use the video to help you transform someone's life. Very important message she has given. The ecosystem or psychosystem in which somebody stays in is very important in beating cancer. So join in, support your neighbors, your friends, and by the way, cancer is not transmitted by sitting next to someone in office. Okay, so feel comfortable. And you can only prove that by going to test to the laboratories or to the medical facility. Mr. Baguma, come forward and ask us a question. Come forward. I think yours will be the last question. For the people online, we don't hear you. Thank you.
Yes, this is very true. We have had some, not all churches, but some churches or worship centers praying for patients and they don't come back. But also, I think I take it to the side of the patient and the family. At times, there are families that put a lot of pressure to the patient. Because the patient come and we counsel them, they agree, then they say, no, it's my mother said she prays here, so I have to be here. So also the families that we live with have put pressure to these patients. I take you to this church, I take you to this mosque, I take you to this, and then the fighter or the victim loses it. So at times you don't blame the church, these people remain, want to remain there. But some churches, we work with some churches, actually there is a pastor, the church was in Chireka, and then he brought a patient to us. This patient would go to the church, have all the overnight, because she didn't want her breast to go. And some churches have been very cooperative, and they have really, and we have started to engage church leaders, so that those who do it unknowing, then they will work with them.
Thank you very much. And I think it's very important to remember the President's message. Just recently when we were talking about Ebola, that some people have been confused to go to shrine, to churches and other places. Please, let's pray, let's believe in God, and let's also believe in the wisdom He gives the experts, the medics, that will help us to be able to fight a better battle. I request at this point to call upon Carol to close and also maybe to say something special to all of you that have come. Anyone without a ribbon, please see me. I need to buy for your ribbon before you go today. Thank you.
Thank you very much, ladies and gentlemen. Thank you so much for giving us your time, for your attention. But at this time, I really say thank you to Justice and Herbert. What we have learned, at the end of the day, you can't buy some of this information. Even when we go to Mr. Google, one of the things I am learning is seek medical advice from the expert. Not Mr. Google, not your neighbor, not your father, not your mother. Please, let us always run to the expert. If there is anything that you think is unusual, it is only you who knows your body. No one else knows your body like yourself. Not even your sweetheart knows your body the way you do. So my message is, whatever it is that seems unusual, please let us seek medical advice from the experts. Gertrude has said we should do the tests from age 20. So the young girls, let us go and ask for the test. At Aga Khan, I think they charge 90,000. But what is 90,000 when it comes to just doing the test and treating cancer for a lifetime? Let us look at the opportunity cost. It might be expensive, but you are saving yourself. The English have a saying, a stitch in time saves 9. Let us always remember that. Gertrude, on behalf of management and the staff here, we are humbled by your presence. And we can only say thank you. Thank you, thank you. We continue to pray for you and for the entire team at the Uganda Women Cancer Support Organization. And we pray that we can continue with this partnership. We shall invite you again. Gentlemen, they said next month is prostate cancer month. Please, please, Baguma and team, Baguma and team, I'm saying this. Guys, my father started cancer. He started doing his checks, I think, from age 60. And guess what? Along the way, he actually was diagnosed with it. The other day I went to see him and he said, guess what, Carol? They have said I should stop the medication. For us, it is victory. But it has happened because he has been steadfast. From the time he was told, go, and all these hospitals have it. Novick Hospital is going to announce something. Ruby will announce something. Kampala Hospital will announce something. Please take time to go and get tested. We all fear because we don't know the unknown, but it is better to know than not to know. Because when we get to know early, we are able to do all these things early. Guys, management has given us an opportunity on Tuesday and Friday. Baguma, I have never seen you. The people I've never seen, Kabusi, I've never seen you. Patrick, please come and we dance. Let us do exercise. Management has done this for us. It is not for just a few people. So every one of you, I encourage every one of you to come. Come with your friends. Come. Let us dance. It's dance for fun, dance to save life. Man, every Tuesday, every Friday, we are at the parking lot. Please come. We've been invited to attend the team on Friday. Sam, I think we need to tell our instructor. Please share with us the dance, everything that is required. We shall practice with our instructors and we shall join you on 4th. I pledge that we shall join you. At this juncture, I'd like to thank all of you for your time and wish you all a blessed weekend. Thank you very much for coming.
5 people have won themselves the kits. That is Natu, Marco Kabuzi, Esther, and then Patrick Mobangizi, even the Sobozi. Within the week, we shall give you your kits. But he will give you tips on the dancing and what happens at the dancing. What should someone do to be part of the dancing? Maybe you can also dance for us.
We have a choreography which we can share, but you're free to dance the way you want to dance. And what it takes, our entry ticket is the dancing kit that we have showed at 20,000. So we have them in different colors and with different messages. So we have those for survivors and we have those with a message and a different content. So this will be our ticket to the dancing to MTN Arena. And we will go at 6 p.m. to 9 p.m. We shall have instructors, but in case you need to practice, we shall send the choreography. I'll share it immediately.
Thank you very much. Friends, it's been a good time to have you here. And specific thanks go to the management for allowing us to participate in such engagements that are not only for our safety but also for the other people. Special appreciation to our AVs, Madam Babasi and Mr. Maina Kariuki, who are very supportive for HR, for the people support. I know the Managing Director, Mr. Tambi, is likewise up there and appreciative of such engagements for staff. Thank you very much. We wish you the best. Please, gentlemen, support your wives as they test for this breast cancer. And wives, enable and push those guys to go for prostate cancer tests and any other tests that are out there. We want to thank you very much. And we are suggesting, at least you can take a group photo to have that time when you remember, at least we were informed, we were given information. You can step forward here and take this picture. Thank you very much. And the videography team and the Zoom team, thank you very much, guys, for coming in and supporting us. My girls of Safi, thank you very much for coming and being part of the team. You're always with us, and we are family with you. Thank you very much. Babazi, I want you to come forward. Come and have a seat for you. Baguma, you are nice on photographs. Please come and stand in front here. All of us right here, yes. Thank you very much. Thank you very much. Where's Umaru? Okay. Thank you very much. Sandra, part of this team, weren't you part of the training? And feel free to take a bite, a snack as you walk out. The drinks, I'm not taking any at home. They're all for us. Are we all here? Are we all in the picture? The lucky people? Let's join in. Are those as tall as me, Linda? Can start a little bit right in front. Go by the left button, but don't push to be ahead of you. Okay. Push and push inside. Don't push on the side.